Welcome to today's lecture on the topic of Niemann-Pick disease. Niemann-Pick disease is a group of rare genetic disorders characterized by the abnormal accumulation of lipids, particularly cholesterol, in various organs of the body. These disorders can have severe neurological manifestations and can significantly impact patient quality of life. In this lecture, we will explore the genetics of Niemann-Pick disease, the role of lipid metabolism in cellular function, disruptions in lipid metabolism that occur in this disease, cholesterol accumulation, clinical manifestations and disease progression, neuroimaging techniques for diagnosis and monitoring, laboratory findings, as well as specific types of Niemann-Pick disease and available treatments such as enzyme replacement therapy and substrate reduction therapy. Niemann-Pick disease is primarily caused by mutations in genes that are involved in lipid metabolism. There are several genes implicated in the different types of Niemann-Pick disease, including NPC1, NPC2, SMPD1, and others. These genes play a crucial role in the transport and metabolism of lipids within cells. Autosomal recessive inheritance is the most common pattern observed in Niemann-Pick disease, meaning that both parents must carry a mutated gene for their child to be affected. Genetic testing and counseling are essential for individuals with a family history of Niemann-Pick disease to understand the risk of having an affected child. Lipid metabolism is a complex process involving the synthesis, transport, and breakdown of lipids. Lipids are essential components of cell membranes and play a critical role in cellular function. They provide structural integrity to cell membranes and contribute to the proper functioning of various cellular processes, including signaling and energy production. Disruptions in lipid metabolism can have profound effects on cellular function and can lead to the development of diseases such as Niemann-Pick disease. In Niemann-Pick disease, genetic mutations disrupt the normal metabolism of lipids, leading to their abnormal accumulation in cells. This disturbance primarily affects the lysosomes, which are cellular structures responsible for the breakdown of various substances, including lipids. In Niemann-Pick disease, lysosomal dysfunction results in the impaired breakdown and clearance of lipids, leading to their accumulation. This accumulation can have detrimental effects on cell function and can ultimately lead to the clinical manifestations observed in this disease. One of the hallmark features of Niemann-Pick disease is the abnormal accumulation of cholesterol within cells. Cholesterol is a type of lipid that is vital for various biological processes, including the synthesis of hormones, bile acids, and vitamin D. However, when cholesterol cannot be properly metabolized and eliminated from cells, it can build up and cause cellular dysfunction. The accumulation of cholesterol in various organs, including the brain, liver, spleen, and lungs, contributes to the clinical manifestations observed in Niemann-Pick disease. Niemann-Pick disease can present with a wide range of clinical manifestations, which vary depending on the specific type of the disease. Common features observed in most types of Niemann-Pick disease include hepatosplenomegaly, enlargement of the liver and spleen, progressive neurologic deterioration, and respiratory problems. Other symptoms may include hypotonia, feeding difficulties, developmental delays, seizures, and cognitive impairments. Disease progression is typically characterized by a gradual deterioration of neurological function and can significantly impact the patient's quality of life. Neuroimaging techniques play a crucial role in the diagnosis and monitoring of Niemann-Pick disease. Magnetic resonance imaging, MRI, can provide valuable information about structural brain abnormalities, including the presence of white matter changes, atrophy, and abnormal signal intensities. Diffusion-weighted imaging, DWI, and magnetic resonance spectroscopy, MISS, can offer insights into the microstructural and metabolic alterations associated with the disease, respectively. These neuroimaging modalities aid in the early diagnosis, monitoring of disease progression, and evaluation of treatment response in patients with Niemann-Pick disease. Laboratory findings in individuals with Niemann-Pick disease can provide important diagnostic and prognostic information. Analysis of blood samples may reveal abnormalities in liver function tests, with elevated levels of liver enzymes and triglycerides. The presence of foam cells, which are lipid-laden macrophages, can be observed in bone marrow or tissue biopsy specimens. Additionally, measuring the levels of specific proteins and lipids in cerebrospinal fluid, CSF, can sometimes aid in the diagnosis and monitoring of neurological involvement in Niemann-Pick disease. Type A Niemann-Pick disease is the most severe form of the condition. It is characterized by a deficiency in the activity of acid sphingomyelinase, ASM, an enzyme that breaks down sphingomyelin, a specific type of lipid. The absence or impaired function of ASM leads to the accumulation of sphingomyelin within cells, particularly in the central nervous system. Type A Niemann-Pick disease typically presents in infancy or early childhood and is associated with rapid disease progression and a shortened lifespan. Type B Niemann-Pick disease is a less severe form of the condition compared to Type A. It is characterized by a deficiency in ASM activity, similar to type A Niemann-Pick disease. However, in type B, the onset of symptoms may be delayed until later childhood, adolescence, or even adulthood. Although the neurological manifestations are typically milder, individuals with type B Niemann-Pick disease can still experience hepatosplenomegaly and lung and liver dysfunction, along with other systemic features. Niemann-Pick disease type C is caused by mutations in the NPC1 or NPC2 genes, which can result in impaired intracellular lipid trafficking. This impairment leads to the accumulation of lipids, including cholesterol, in lysosomes. Niemann-Pick disease type C is characterized by a wide range of symptoms and can affect multiple organs, including the brain, liver, spleen, and lungs. Neurological involvement is prominent in Niemann-Pick disease type C and can manifest as progressive cognitive decline, ataxia, dystonia, and seizures. Enzyme replacement therapy, ERT, has emerged as a potential treatment option for certain types of Niemann-Pick disease, including type B. ERT involves the administration of a recombinant enzyme that can replace the deficient or dysfunctional enzyme in the affected individuals. This therapy aims to reduce the accumulation of lipids and alleviate disease symptoms. ERT has shown promising results in improving liver and lung function in individuals with type B Niemann-Pick disease. However, its efficacy in treating neurological manifestations remains limited. Substrate reduction therapy, SRT, is another therapeutic approach being investigated for the treatment of Niemann-Pick disease. SRT aims to decrease the production of lipids, including cholesterol, by inhibiting the enzymes involved in their biosynthesis. By reducing the availability of lipids, SRT can potentially slow down the accumulation of lipids and mitigate disease progression. SRT has shown some beneficial effects in animal models and is currently being evaluated in clinical trials for various types of Niemann-Pick disease. In conclusion, Niemann-Pick disease is a group of rare genetic disorders characterized by disruptions in lipid metabolism, resulting in the abnormal accumulation of lipids, particularly cholesterol, in various organs. The disease can present with a range of clinical manifestations, primarily affecting the neurological system. Diagnosis and monitoring of Niemann-Pick disease rely on neuroimaging techniques and laboratory findings. Treatment options, such as enzyme replacement therapy and substrate reduction therapy, show promise but have limitations. Further research is needed to improve the understanding and management of this complex disease. Thank you for attending today's lecture on Niemann-Pick disease.